Democrat spokesperson Luke Taylor.
Thank you very much, Madam Deputy Speaker. The epidemic of knife crime has been an issue I've addressed many times in this place, though never in a debate specifically targeting its impact on children and young people. I commend the gallant member for Huntingdon for securing this debate on such a significant matter. In Britain, we face a hard truth. Young people are increasingly involved in violent crime, and this cycle is becoming ever more entrenched. Figures from the Ben Kinsella Trust show that across the country, 614 young people under 24 have been killed by knife crime in the last 10 years, with 17 of those being 16 or younger. Children are being exposed to the tragic normalisation of stabbings. We have sleepwalked into a scenario whereby many young people feel it's safer and easier to carry a knife to defend themselves. Threats of punishment are in this context unsurprisingly failing to deter violent behaviour. Knife crime should be treated as the societal disease it is, and we cannot afford to just treat the symptoms anymore. If this government is to truly tackle knife crime, it must address its roots, the deep-seated factors that drive young people to such violence in the first place. Madam Deputy Speaker, to tackle knife crime, we must stop it before it starts. We must use a public health approach that addresses the root causes: fear, trauma, lack of opportunities and social exclusion. This approach has many tenets, some of which I shall outline today. It begins with education. When young people carry knives, it is often out of fear, not necessarily out of a desire to harm others. A study by the Ben Kinsella Trust revealed that over 1 in 3 young people don't feel safe in their own communities. 36% don't feel safe walking the streets, and 2/3 report anxiety over knife crime in their areas. The teenage brain is wired differently from adults. We know that a tendency towards impulsive and risky behaviour is much more common during adolescence. Studies show that in many cases, knife crime occurs in the heat of the moment, where an altercation could have been resolved without serious injury if a weapon had not been present. This is exactly why we must address the issue before it happens, before the knife is ever pulled from a pocket and escalates beyond control. Education can play a principal part in challenging the misconceptions that carrying a knife somehow makes you safer. It's about teaching young people the real consequences of carrying this weapon, how it destroys lives, impacts families, and perpetrates the fear amongst their peers and communities. Absolutely.
I thank the Honourable Gentleman for giving way, and he's making an excellent speech about an issue that I think we all would agree with across this House. I've spoken a number of times with Harlow Police Department about the issue of knives and knife crime, not just in Harlow but across Essex, and they do a lot of work with schools, and I think, would he agree with me that it's important that schools fully engage with the police in these issues and don't see it as a stigma to their school, and actually that they need to all engage with that process?
I completely agree. I'll come on to a section a bit later on, but I spoke to the organisers and leaders of the Chris Donovan Trust in my constituency, who spoke particularly about the challenges getting into some schools to talk about knife crime, because the perception that they were going to talk about it was a problem in itself, and it was so frustrating to hear. We need to have honest, open conversations with young people in schools. Teachers must be equipped with materials to educate the next generation to break this cycle of violence. Even if a child is not at risk of committing a knife-related offence, educational programmes serve a critical role. They can teach children about the consequences of knife crime long before they may consider carrying a weapon. And that's vital. We need to reach young people and win the war for their hearts and minds before the prevailing climate of fear and the harbingers of toxic mindsets can start their offensive. I urge the government to consider introducing mandatory PSHE lessons on the consequences of weapons possession and put the principles of restorative practice on the curriculum, in recognition of the great work of groups like the Chris Donovan Trust in my constituency. We teach children about the dangers of diseases caused by smoking or alcohol from an early age. Why then are we not having open discussions with them about the health risks associated with carrying a knife? By creating safe spaces for discussion and building relationships with young people, intervention can occur before thoughts of crimes arise, and deaths can be prevented. But to fully realise the nourishing, community-focused element of a public health approach, we must also invest in youth services and community programmes that engage young people. Winning that war for hearts and minds means providing them with opportunities to build skills, pursue education and find alternatives to gang culture and criminal activity. And yet we've seen a dramatic decline in youth services funding in recent years, as has been mentioned in many speeches. cuts totalling £1.1 billion since 2010, and this has left too many young people without the support they need. Investing in youth service is not just about providing a safe space, it's about providing young people with alternatives to violence that can break the cycles of crime. It's about shifting the culture of violence and empowering communities to work together to prevent crime before it escalates. The Targeted Early Help and Integrated Support team at Sutton Borough Council in my constituency do exactly this kind of work, offering opportunities to young people who are not often afforded the luxury of such attention elsewhere in their lives. And yet these programmes rely heavily on grants from MOPAC, the Ministry of Justice and Violence Reduction Services, grants that are subject constantly to uncertainty, often approved at the last minute, and often only allocated for 18-month to 2-year periods, preventing proper forward planning. Madam Deputy Speaker, we must do better than that. We need to consistently get serious funding to these initiatives in a timely manner, and I echo the calls from the member for Dulwich and West Norwood for funding for these community schemes. On these benches, we'll continue to push the government to make youth diversion a statutory duty, so that every part of the country has a pre-charged diversion scheme for young people up to the age of 25. That will ensure better outcomes for young people and less strain on police resources. But let's be honest with ourselves. Those police resources are already strained beyond breaking point in too many places, and education and early intervention alone isn't enough to properly implement the public health approach. Visible community policing starts with actual police numbers in our London boroughs. And to tackle knife crime, it's important for young people to see actual bobbies on the beat in London. Their active and engaged presence creates a sense of safety and security. We have to get back to a meaningful community policing, returning the police to their proper duties as a positive, engaging arm of the state in people's lives. Building trust between young people and the police is also crucial. This trust communicates there is no need to carry knives for protection, as young people know the police are there to keep them safe. As I've said before, when 17-year-old Ilyas Habibi was stabbed to death outside Sutton Station in my constituency in December 2023, he was just minutes away from a police station. And if we cannot expect visible policing in town centres and the areas closest to police stations themselves, then I ask this House, how little have we come to expect of community policing? To be clear, this is not a criticism of the police. It is a criticism of successive governments and mayors who have consistently failed to get police the resources they need to do their job. In London, far too many are abstracted away from the communities they are supposed to serve to help plug gaps. I was deeply concerned to learn of Sadiq Khan's budgeting decisions, which have led to dedicated police officers in schools in London to be removed. Under the new Met for London plan, officers will no longer be stationed in schools as part of the Safer Schools Officers Programme. While the plan claims that officers will still work closely with schools, this reduces the consistent, direct contact between officers and young people. This contact is crucial in building relationships with young people to foster trust. There should be plenty of positive interactions and experiences with the police throughout young people's formative years. This can be achieved through school assemblies or through classroom workshops. Young people need to understand that police are there to keep them safe on the streets and are not the enemy. But when sparse police resources are focused only on the most extreme forms of deterrence, such as live facial recognition and stop and search, and no community focus, it is unsurprising that they do not. The hallmark of a public health approach, a meaningful one that has the investment not just of money but of serious political capital, is that it brings together all groups in our communities. It creates a coalition of care, it breaks down the silo walls between projects, and it builds a team across society, a team committed to doing what it takes to rescue young people. And so, Madam Deputy Speaker, on behalf of countless experts, professionals and parents, on behalf of those young people themselves, I implore the government to build that team, create that coalition of care, and finally implement a meaningful public health approach to knife crime. Thank you.
I'll shadow